Good afternoon, everyone. My name is Simran Chaudhary, and I warmly welcome you all to today's important discussion on decoding the human metapneumovirus insights and strategies, organized by Voice of Healthcare. Our goal today is to spread awareness, provide accurate information, and address the ongoing misinformation surrounding HMPV and viral infection affecting the respiratory system. And today, we are truly privileged to have with us Dr. Dilip P. Bhanushali, a distinguished general physician with over 40 years of experience in the medical field. Dr. Bhanushali's expertise spans across several specialties, including neurology, dermatology, gastroenterology, and diabetology, among others. Throughout his career, he has made significant contribution to patient care, medical education, and leadership within the healthcare community. Most recently, Dr. Bhanushali has appointed as the National President of Indian Medical Association, and we would like to take this moment to congratulate him on the well-deserved recognition. His leadership and dedication to improving healthcare standards in India will no doubt have a lasting impact. Dr. Bhanushali, thank you for joining us today. It is an honor to have you in our studio and you're ready to share your insights on this crucial topic.
Thank you and
Welcome.
namaskar to my viewers. Yes. Go ahead.
Thank you so much, sir. So, as we just mentioned about, and we would like to congratulate you again on being elected as the National President of the Indian Medical Association. So, your tenure has just begun. So, can you share your vision and priorities of the term you're looking forward to? And are there any some key agendas you would like to solve or what would like to address on priority basis?
At the onset, let me thank you for getting me on this. Uh, as a viewers must be knowing that IMA is the biggest medical organization not only in India but throughout the world, with a membership of 4 lakhs as a MBBS doctors, 2 lakhs as a medical students, and 2 lakhs of junior doctors. We almost 6 lakhs membership of IMA. This is the political front of medical field. IMA. It is a mother of all organizations, under which all the specialized organization coming. So IMA represents, as I said, is the political front of medical fraternity, and whatever the problems doctors are facing nowadays, this has been fought by IMA. So I have taken over this leadership. I'm thankful to Paramatma, my parents, my departed wife, and all the 4 lakh members of IMA for getting me to this position. IMA doctors have been, the softest target nowadays, and they have multiple problems. Right from violence against doctors, which is a major part, and what the public has seen recently at the EK car Calcutta incident,
Yes.
which is a which is so recent and which has not been solved yet. I was told that we are going to get that verdict today by some court in Calcutta today. So by evening we should know what has happened to that case. So violence against doctors is not a new thing, but it has been increasing day in day out. Though 21 states have their specific regulations and this thing, government have passed it, but it's not been implemented. Some of the clauses are not favorable for getting things moved or things to the culprit to be arrested. It was 3 years, mandated it should be 7 years. So we are asking the government to do it. Government did it during the COVID period. Special regulation was passed. We want that it should continue and government should change that Asa Sarita, what is the code nowadays they say about this, and change that code so that the regulations are strict and the culprits are punished to this. So violence is the most important thing which are going to fight. Though they say that it is a state subject, law and order is state subject, but unless the center passes a strict law, it's not going to be implemented. So that's number one. Second thing is most havoc thing is going out about mixopathy. government is this Ayush what government is propagating. We are not against any Ayurvedic. We are not against homeopathic. We want they should practice their own medicines what they have been taught. If you see
Yeah.
the scenario, 90% of the homeopaths, 90% of the Ayurvedic doctors write allopathy drugs. The problem rises there. Okay, doctors, when there are so many quacks, more quacks than the doctors in the country, and they are playing the havoc. Havoc in sense resistance against antibiotics. If you go to a quack in a village he writes third generation of antibiotics. He doesn't know what the effects, what are the indications, and that has caused antimicrobial resistance throughout country. And we are facing a tough problem because we will not be having a good antibiotic to fight so many diseases. So quackery is one more thing. Third thing is about the Consumer Protection Act. We have been fighting for this, and it has come to the logical end. It's come to the Supreme Court. We are we have filed a case against this. We'll see what the court says. Since it is subjudicial, I don't want to comment more on that. Then want to reach a common member of IMA. A common member of IMA, what are these problems? How are we going to solve? As I said, these are some of the major problems which we are facing. So I'm going to concentrate on this and see.
Thank you so much, sir, for explaining us and giving insight about your vision and what are your plans for your term. Like we discussed about so many other things, that what exactly is the need of the hour to address, that is the violence against doctors, and how this AMR is being getting increased, as then we would need a strong antibiotic to fight against disease. Other than this, as you just said that IMA is the specific, a very big organization to address the health issues of the organization, in of the country. So, are there any specific health issue do you aim to address during your presidency, other
Only I
than
think
the AMR?
day before yesterday, I was in Bombay where we signed a MOU with the FOXI, that is Federation of Gynecological Society of India.
Yes, yes,
Their phase two project about the vaccine, right? Anti-cervical cancer vaccine. And I may, along with an American Cancer Society, which is funding this project, we want to train
yes,
50,000 doctors of IMA regarding this vaccine. So this project we have taken on a big way. On phase one, they have already trained 10,000 doctors. We want to train 50,000 doctors this year, where the trainers will train these 50,000, and in turn, those 50,000 doctors will train the other people regarding the importance of anti-cancer vaccine, cervical cancer vaccine. So the vulnerable age group from 9 to 14, where we recommend to give this vaccine, we are asking government to include this vaccination in the national vaccination program. IMA also is going to join FOXI, Pediatric Association in India also has recommended to the government that they should be added into the national vaccination program, and we are going to support that. About this
and so
new virus which everybody is so eager to know. Uh, See what we saw during COVID period, right?
yes, sir.
In Hindi there is a कहावत, दूध दूध का जला हुआ छाछ भी फूक फूक के पीता है,
Yes, sir.
right? So with that psyche behind, people are afraid that is it like a COVID or what? But this is a common cold virus which has not come somewhere new. It's been there for last 2 decades. Every winter, every this thing it comes. So nothing to worry.
I
Only thing
was
yes, you have to be careful in sense. So it can spread with droplet infection from person to person. So a precautionary measure like a mask, not to go into a crowded places, eat healthy food, normal diet, do your exercise. That is routine thing what we recommend. So nothing specific that we should do about it. And
So, like
there's
you
no
just
cause of
address
panic.
this. Yes, sir.
That's
As like you just address that this new like you said, दूध का जला तो छाछ भी फूक फूक के पीता है. So HMPV is the growing concern nowadays, and that's why we wanted to know this all about HMPV from you. You're the best person to talk about, right? So as this is become taking a lot of space nowadays, what whether you just open a news channel or newspaper or any of the healthcare news, it's all about HMPV, HMPV, and HMPV. So even if they're just spreading the updates, it's becoming more of a hype. It's creating that panic. So from the basic, if we have to start or to know, if you can guide us, what exactly is HMPV? Like how does it, happen to your body? How it since it's a communicable disease, I believe. So how does it happen from one person to another person? And it is happening since last 2 decades, but it has gained that limelight after the COVID, I believe. And the credit goes to the COVID and the mishaps and everything which happened because of it. So we want to know from the basics from you, sir.
the basic is since during COVID period, it was a new virus, and how difficult it was, and what are the difficulties we all faced throughout the world, not only in India. And that psyche and that fear has crept in, that is it this virus also like a COVID virus? It's not like that. It's a RNA virus which is a common cold virus which can affect vulnerable people, in sense below the age of 5, above the age of 60, and patients who have comorbidities or they are
Hmm.
immunocompromised. So those are the people who can be get affected. It's not a life-threatening disease. It stays for 2 3 days, goes by itself, doesn't have any specific medications. You just have to be take care, take rest, don't go into crowded places, cover your mouth, wear a mask, eat a healthy food, drink plenty of liquids, and be normal. Get the treatment.
So will it affect badly to the people or the old age people who have this comorbidities like diabetes, some already present lung issues or something? Is it deadly for them, or it is
No,
not at
it's
all
not.
deadly for
It's not
anyone?
at all. It's not at all deadly. If at all,
Okay.
see, it is affected by a bacterial infection on a viral this thing, then you require antibiotics and all. Otherwise, you don't require any medicine.
And when is the right time to go to doctor if a person has, first of all, we need to know the symptoms of this. And at what stage?
Symptoms are common: fever, body pains, cough, and cold. For any viral fever, that for that matter, no
Okay.
specific symptoms are there for this.
So, and what stage the person needs to go to the doctor that, this has become a little bit of serious. Now it's the time to go to doctor or visit.
If the fever persists, right? And especially people who have immunocompromised or more age of 60 or below age of 5, of course, you have to see your doctor, see that no complication devices. But 99% of time, it doesn't require.
Okay. And does the person who has been affected with the HMPV needs to stay isolated, that, it may transfer to the other person or something,
See,
quarantine or anything?
in our daily routine life, we have seen common colds. See, a person having common cold, it can transmit to anybody. It's not specific. Any virus can cause this. So the precautionary measures, as I said, wearing a mask, avoiding a crowded places, is the most basic thing we can do.
So, Dr. Bhanushali, 2 days back, WHO also released an official statement that the cases of HMPV could increase in late winters. So, can you elaborate on why this might happen and why the cases will increase in late winters only? And we are
Any,
also seeing this increase.
any viral fevers, if you have seen, the peak is in winter periods. They multiply more in winter, in the cold atmosphere. The multiplication is more. That's why they say in the cold winter it increases more. And what we see, common cold and all, it's more in winter period. So there is nothing specific that it only comes. It can come any time, but it's more in winter.
And it gained the limelight when it started spreading in China, and the news started coming up that China has witnessed a new virus called HMPV. These many people are getting hospitalized, such everything is so many other things. So if I have to understand what exactly is the situation in China about of HMPV, and is it something else which is happening in India other than that? uh, are there more people suffering from HMPV, or at a, deadly stage, or any kind of other stage different from India?
See, anything come from China is sensitized, right? I think, I think we have been over-sensitizing, especially the press is doing more,
Yes.
right? Why suddenly so much of coverage? There are 101 things in the medical field. People die more of accidents. People die more of cancer. People die more of tuberculosis. Why not talking about that? And why we are talking about this irrelevant viral fever and so much of who and hangama about it? Because it has come from China. And half of the time we don't know what's happening in China. Even today, see whatever they release through the press or whatever we come to know, how far it is true, who is going to tell us about it? Of course, because population wise, like India, their population was very high, and they don't want to, that it should spread in a big way like it had done. But as such, this virus is not so dangerous like COVID. Just because it has come from China, people are worried about it. But it's there for last 2 3 decades. It was in US 1950s. It was detected this virus, and every year somewhere part of the country we have this. So nothing new.
So, like you said, it's nothing new, and it's been there since last 2 decades. But why suddenly this it is so much in the news? And even though states health ministries, state hospitals have released statements that we are ready with our beds, we are ready with the oxygen, we are ready with everything. But why they've started doing all these things now? And even let's say it is not a big or a deadly disease or anything to worry about, but because of the such statements, it is creating little bit of panic amongst the citizen as well. If the government is all prepared because of this, then this might be a problem for everyone.
Why government is saying about this? Because you have seen during 2019 COVID period where we were not ready for COVID, and because of that, thousands of deaths have occurred. We were not ready. We didn't even have our masks that time. We didn't have oxygen.
Yeah.
We didn't have beds before this. And probably that psyche has been going on. That sometimes if this converts like a COVID epidemic,
Hmm.
so government is saying beforehand that we are prepared for any eventuality, whether and of course it's not going to happen. We are sure for that.
Hmm.
But to give confidence to the public, government say we are ready with any eventuality.
So is there a chance that we would require this oxygen supplies and everything in this,
No,
since it's also respiratory no.
no. Up till now we haven't seen. I mean, even in China, it's not there.
Yeah. But then also government is saying that we are ready with everything.
That's we are just giving confidence to the public that public should not panic.
And are there any specific nutritional habit or lifestyle habit that can strengthen the immunity against this virus? A specific.
Common things. What common is not for specific for this virus. For any immunity to increase, your lifestyle changes has to be done. See, your daily routine has to be followed for not for this virus. So your immunity part of it, of course, you require to fight other diseases. There are so many diseases we are fighting. So specifically,
So
nothing for this.
So even the Union Health Minister, Shri JP Nadda, tried to calm down the situation, the panic that there's no need to worry. It's an old virus, or It's an old
Yes.
disease which is going on and nothing to be worried about, but still so much of things is going on. So given the current scenario, do you foresee that government will be introducing any specific policies or guidelines to address the rise in HMPV cases or to decrease the panic around this?
So decrease the panic, government have come out with a notification that people don't have to panic. These are the common things which can occur. These are the symptoms. What precautions you have to take. They have been doing it. I mean, government has come with that. That's just to public to know. Okay, there is nothing specific treatment for it, nothing to panic, and these are the common precautions you have to take. So, on a precautionary note, government has come out with this notification.
So, like you said, that HMPV is not something to be worried about, and it's just a common cold and flu. And I believe then there's no need for any different or new type of vaccine or any different type of treatment required. But as the IMA president, how do you plan to collaborate with government and international organizations like WHO to address public health challenges? One like HMPV, which is creating a panic, and something other which may come around because of the ongoing changes. Because like what we have saw during the COVID time, virus is developing in a seconds. Things are changing, new things are coming up which we are not aware of. So how is IMA is planning to collaborate with the health organization to take on these new challenges?
IMA is always with the government in fighting out the national programs, right? With what we did during pulse polio, what we did during tuberculosis control programs. So any government programs, IMA is in forefront to fight with and help government with this. So in the similar manner, during this viral infections, we are saying we are also coming with the guidelines. We are educating our patients, we are educating our members that there's nothing to panic. These are the precautionary things you have to take and raise the confidence of the lay public. See, lay public are of course they are panic, so they have to come bit down. There is nothing to worry about it. You have to take these precautionary measures, and things should be all right.
So, any specific message you would like to convey to the public to elevate the fears and encourage responsible health practices regarding HMPV, and for the hospital and the doctors as well, so that they can be prepared well, or how to tackle with this? Because recently, today's case has come up that an 8-year-old male has been diagnosed or been detected positive with HMPV. So, any special precautions needed for the young infants or the older people?
As you said, government is surveillance. Of course, is important for any viral fever to know how it is
Hmm.
spreading and how many people have been this. But it's not a notifiable disease as such. Like tuberculosis, it's not a notifiable disease. Say how during COVID 2020-23, many patients had COVID, but nobody came to the doctor and got tested, right? So similarly, day in day out we have cough and cold. It will pass up by itself like a flu, right? Seasonal flu.
Yeah.
For that, of course, Dadi Ba ke nuske they also help. Though most of the people they do it and it affects. So important is you have to be surveillant about it. You should know what's happening about it. Government is doing that. It has kept everything in place in case it spreads. But the history says what we have seen for so many years. This virus is not virulent.
So then we really don't have to worry about.
Yeah, we don't.
And
Yes.
yes,
I
and
think
you
more
have
more
given.
important more important than this, the press has to play a major role. Don't sensitize it.
Exactly.
Don't sensitize
Exactly.
it. Right? See,
So,
first day it came on a headlines, then slowly it will come in the last page in a small this thing that there are no more viruses. So sensitization should be stopped because public hue and cry so much of hue and cry. That's why public is building panic. Why so much of hue and cry about this?
correct. Yeah.
Treat it as a normal cough and cold viral fever. That's all.
That's it. And that can be treated at home. There's no need to
That's
create panic around. There's no need to report that, oh my God, this much cases has come up or anything like that, because it's nothing to worry about. We have
that.
got the clarification from the authority and from the correct person. So since we talked a lot about HMPV, I would like to shift your attention to a different topic. I think this is coming up in another 1 or 2 months, that in a coming month or so, health budget will be announced, right? So last year there was so much of expectations and so many other things, like we went to the stories and everything. But I want to know your expectations, that what do you feel that government should focus more on, and what are the initiatives that they can take, and in case and for the coming financial year as well, what IMA is planning to focus more on.
And I'm glad that you took out this question. See, 1.4% of our GDP has been as in health.
So,
This is absolutely lowest among all our neighboring countries. Forget
yes.
developed countries. So I is asking that health budget should be increased roughly to 4.5 to 5% of our GDP. Right now it is only 1.4. So if you want to be a developed country, as our Prime Minister is been telling all this, like by 1445, India should be a developed country. To have a developed country, you should have a healthy nation. Healthy nation, of course, could be have if you have your infrastructure in place, your health budget should be healthy. 1.4% is not a healthy budget. So we are
Yes.
asking that it should increase.
And what are your expectations that government should focus or come out with new health schemes? What health schemes or a particular health area they should focus on?
See, government has come out with a lot of Arogyasri is there in our state, like Pradhan Mantri Ayush Yojana, which has been benefited giving 10 lakhs of rupees for. It's a There is a very big project that has been very well implemented. I'm should compliment the government for this. The insurance 10 lakh rupees what the government is giving is definitely percolating to the poor people. It is one of the good projects that the government has done. So insurance is a big challenge to be covered to the common man, and government should focus on that, cover more people in this. That's number one. Of course, for any disease, prevention is the biggest thing.
Yeah.
For any disease, government should focus. As I said, we want this HPV vaccination as a preventive measure. This is the first biggest, commonest cancer in women. So if you can prevent with a vaccine,
Why not then?
nothing like it. But see, in our society, in our country, people come with very late stages of disease of cancer. So the education part of it, prevention part of it is the most important thing, and IMA, of course, is going to go all way to help in this.
So, like you raised the topic about HPV vaccine, and January is known as the Cervical Cancer Awareness Month, and
Yes,
you just mentioned that it is one of the common cancers in women, and
yes,
we are lucky that we have the vaccine to prevent this.
that's right. And
And
luckily, this vaccine has been manufactured in India and is cheaper now.
India, yes,
Serum
yes,
Institute
so
of India has come with,
Serum
I
Institute,
think it's only 2,000 per dose, which was earlier more 8 to 10,000. It has come down.
yes, so
I
but
mean,
I believe this.
government with subsidies is giving. We are asking it should be given at 400 rupees in subsidy rate. We have been writing to the health ministry about this, and IMA, along with other organizations like Foxy and Pediatric Association, we will fight for this, and we'll see that this has been included in the national immunization program, and should be covered, on in a big way throughout the nation.
Since it is not covered in our basic immunization thing, and I just want to know, even there's a fight going on for the subsidized rates. as it is costly and not everyone can afford this. And since if we have the option to prevent, then why not? Just wanted to know what could be the reasons that government has not included this vaccination in the basic immunization plan,
So
besides having the vaccine.
why government has not included? Because see, in last what you say 8 to 10 years, there are substantial studies. See, for any vaccine to be included in a mass circulation, then the government should be 100% sure that the vaccine is working. It is without any side effects. Without so there are innumerable of studies about this, not only in India but throughout the world, which has proved that this vaccine definitely 80 to 90% can be cancer can be prevented with this vaccine. So once the government is absolutely sure about this and sure about our vaccine now, which has been manufactured in India, I think government should will come sooner or later.
But so was that done for the COVID-19 vaccine also?
You have seen this. COVID-19 people have seen how not only it helped India, it helped 165 countries. And
It
in fact,
helped, but
it was much better than what Pfizer had done in USA. If you ask any USA citizen, they have taken 8 to 10 times booster dose and still they had COVID.
yes, yes.
Our vaccine was much superior.
But was that study done before circulating the COVID-19 vaccine as well?
Yes,
That
they
the
had
amount of
phase two and first two trials were done before they released in the market. Of course, they can't do it without that. But since it was an emergency, they
yes,
had to release, yes, they had to release
yeah.
it earlier.
So, as there was a speculation around that as well, that the time or the kind of attention a vaccine needs before circulating in the market and amongst the people, the kind of years of trials and everything is required that has not been done with the COVID-19 vaccines. So, and there was this thing ki it might not be safe, it might create some other problems and all such things. So, just to that was just to clear out the air about it. And yes, it was an emergency, it was a pandemic, and we all have seen ki how effectively it worked amongst our country and for the other countries as well. But
That's right.
thank you so much, sir. Yes. Thank you so much, sir, for answering all my questions and clearing the air around HMPV and, settling down that there is no need to panic around this. It's just a cough and cold kind of virus. And Dadi Ma ke nuske will also work. But it's
Yes,
better it's better to take precautions and wear to mask in case you have this so that it does not transmit to others, which we do for all our basic
basic
cough and cold.
common. Yes, that's right. Thank you for getting me in. And my request to all the media person and my friends in media is focus on what more important things the doctor community is facing, the nation is facing with health. So that should be more highlighted in this rather than concentrating on HMFV, right? Right?
Thanks a lot, sir. Thank you
Thank
so
you.
much for spreading this awareness around public health. It matters a lot, and congratulations again on your new appointment as IMA National President.
Thank you very much. Namaskar.
Thank you so much, sir.